So what to expect, how to get started. One thing that's important for you to understand is that we start couples counseling from a position of no blame. I do not take sides, except with a few exceptions that I'll go over with you when we meet, because I believe that each person in the relationship has a role to play in how their issues developed. Often it is years in the making, and it's important to begin with an open mind and with an open heart. So, what to expect? Well, I am a certified Gottman Method couples therapist, and I usually follow that protocol. It is customary for us to begin with both of you coming in together for that first session, and this way you can together describe the reasons that you're seeking counseling. You can start on an equal footing that way, and during that first session I'll ask you to describe the problem, but I'll also ask you for your history together, what brought you together, and I'm looking to see your strengths as well as the areas in your relationship where you need to work. We will also discuss what your goals are for your relationship, and I'll explain more about how I'd work with you and give you an estimate of how frequently we will meet, or we should meet, and for how long. So after the first session together, I usually send you a link to the Gottman Relationship Assessment, which is an online, totally secure, HIPAA compliant assessment that you can take at home alone, separately from each other. It consists of true-false questions that look at how well you know each other, how much cognitive room you give to the relationship and to your partner. It looks at your friendship system, how well you manage conflict. It looks at romance, intimacy, and passion. And it also looks at your goals for your personal and overall relationship goals. And once you've completed the assessment, I'll next see each of you alone one time to get some personal background and history about you. The next session we meet together, and I'll give you feedback about the relationship, its strengths, and the areas that need work based on my meetings with you together and independently, as well as the relationship assessment. And this is often a very positive experience for couples who frequently delayed getting into therapy. And we know from research that couples wait an average of 7 years after they're aware of problems in their relationship before they start therapy. So they often feel a great sense of relief that they're taking action and working to improve their relationship. So from then on, we meet together, all of us, usually once a week. And then when things begin to improve, we can space things out, and the meetings might be every other week or even less frequently if you're doing well, because I realize that finances are often a big issue in relationship, and I want you to be able to come to therapy without straining your budget and therefore your relationship even more. However, people do ask, does insurance cover marriage counseling? And I usually say it all depends. Often it does not cover couples counseling because insurance companies don't consider it medically necessary. But a few insurance carriers will cover it, and I would be out of network for you. I don't bill insurance, but I'd give you a bill, a super bill that you can submit to get reimbursed directly to you. So that's up to you to get that reimbursement. But one thing you should know is that your insurance, if it's going to cover it at all, one of you must be the patient and have a psychiatric diagnosis to make it medically necessary. And once we meet, we can discuss that and see if there's a diagnosis that is appropriate for one of you. For that reason, most of my clients choose to pay privately, and consider it to be an investment in their relationship. So how long does couples therapy take? Therapy can take as little as 6 sessions or last up to a year. But it's my experience that people get the tools they need within several months of starting treatment, and then they know that the door is always open. They can begin to taper off the therapy sessions and then come in as needed. And couples who've completed the treatment will sometimes call me years later when another problem comes up and they feel like it would be helpful to come back. And it makes it a lot easier to do that once you have a history of doing couples therapy. It's not so scary and we know each other, and it makes for shorter treatment at that point. So sometimes people will often ask me, what about seeing one partner and for a few times and not both of you? And I really make that decision on a case-by-case basis, because mostly we want to really work on the relationship, but in some situations there'll be an instance where one partner will say, I feel like I need to work on some things of my own, and would it be appropriate for me to see you independently of my partner? If both people agree, then sometimes that can work well, but we just want to make sure that everyone's on the same page with that and nobody feels like they're being excluded. So that's something that can happen down the line after we've established a relationship of trust and rapport. So that's the way it works, and feel free to give me a call, or better yet, email me, and I can get back to you much quicker by email, and I can give you more information about fees and about location. At the moment, I'm only doing teletherapy, but when masks are no longer required, we will begin to meet in my office. This is my office, and located in Walnut Creek, and it would be wonderful to see you here, and also by teletherapy. So